So for my background, I trained in medicine, and then after some years' work in medicine, I trained in specialty of pediatrics, which is dealing with children. And then I ended up working overseas in Kenya and have been there for 20 years. My current research is basically trying to change the way that hospitals work for children. So we tend to focus more on what the doctors should have around them, or what medicines they should have, or maybe a new vaccine. But we've tended to ignore actually the way people should work so that they provide the best care. So most of our work now is about trying to see how we can reshape a Kenyan hospital and the way that people work inside it so that children get the best treatment. For children's health, I think, is a big deal, particularly for our part of the world. Until recently, it was more than 1 in 10 children who were born died before they reached the age of 5. In some parts of Africa, it's still like that. In Kenya, it's got slightly better. But I think there's a big problem, and the things we can do to alleviate that problem seem to be a good idea. But I think it's an important area as well, because obviously children don't really have a chance to speak up for themselves, so they need some of us to do it for them. We use a variety of methods, and that's one of the things that's interesting, is we do things like use statistics, so people who've got a mathematical background and feel very comfortable with dealing with numbers and algebra. And then we use people from very diverse backgrounds, people who've come to us, done humanities, for instance, done subjects like politics, or done subjects like economics, and they tend to focus more on the way people behave and the way the environment around people shapes the way they behave. So we try and work with all sides of the research to get a big answer. So I think one of the areas we work on at the moment, and particularly focusing on, is really, there's almost an absence of statistics. So actually, often in the African context, we really don't know what's happening with healthcare. We don't know how many people are getting treatment. We don't know how well those treatments work. So we're actually, at the moment, trying to develop some of those statistics. So I can't give you any specific numbers at present, but there are hundreds of thousands of children admitted to Kenyan hospitals every year, and we've not really had a good way of knowing how well they're treated before, and those are the issues that we're dealing with. I think research, the impact of research and the impact perhaps of my research reflects the impact of the broader team of people I work with as much as anything else, and it's partly that we've been working for a long time on some of the same issues. We have got a team of people, we have good links with different parts of the Kenyan health establishment and the universities and things. And I think we've made an impact in a variety of areas, including the way that some of the hospitals do work in the government sector in Kenya. We've made an impact by changing the way people think about research and the types of research that can be interesting. And I think we've begun, in our engagement with some of the younger health workers and health workers in training, began to impact on the way they think about both research but also the way they think about practice. I think if you're thinking about a career in research, then you need to like arguing. A lot of it is about challenging yourself, challenging other people to justify what they're doing. You need to be able to try and take a contrary opinion every now and again, and put your money where your mouth is in one sense. But it's also a lot of work, but interesting, stimulating. I mean, it's the kind of job that you will carry home with you in the evening, which may not please your family too much, but that's the reality. And if you want to leave your job at 5 o'clock in the evening and forget about it until 9 in the morning, then research is probably not the job for you.